It's a beautiful spring day here in paradise. Welcome to Avila Beach. Here we are. I am Dr. Lapidus. You probably, wow, Yelena, how do I pronounce it? You can call me Dr. Eli or Eli. We have a wonderful clinic. It's functional medicine fusion with family practice clinic here in Avila Beach of California. And we're serving all Californians. I also have license in Florida. I'm starting to see more patients on our telemedicine platform here from Florida. And, it's always a question, what can you do for us? So we decided to start with introduction of our clinic and what we actually can do for you. I love being part of that clinic. I love that creation of ours. It's dream come true, truly. We opened the door of the Lapidus Clinic in 2018, in February 2018. And it just became a place where I practice everything I know. And as I'm learning, I'm adding those new elements to my practice. But the most important part of our clinic structure is that always molded around our patient needs. We always customize our treatment plans to every single one of your requests and needs for better diagnosis, for better treatment, for better experience. And of course, as any business owner, we're constantly going through challenges. Last year it was a flood. This year we're trying to expand the team, finding new members of the team, but that's also what makes it fun. So from patient perspective, what can you expect from becoming the Lapidus Clinic member? Or I will mention later our little baby program called Ocean program. It's a hormonal ultimate intimate health program. You can expect a lot. I'm in medicine for 30 years, and I was learning all different aspects of gynecology and hormone replacement therapy in my 20s, and that field just evolved so much. So there's so many different new modalities of diagnosing hormonal imbalances and new way of treating it. But let's get back to our main topic of today. What is the Lapidus Clinic? What is the Ocean program? The base for the Lapidus Clinic, which is a concierge care, is a family practice with functional medicine addition or functional medicine twist. By organizing all my knowledge in the Lapidus method, TLC, the Lapidus Clinic method, I'm allowing myself and you to have comprehensive evaluation every year of all organ systems of your body, starting with your brain, for which we do 19-lead QEEG, followed by cardiovascular health evaluation, and we do a lot of functional medicine tests in the blood work, through your genome evaluation, and also with very advanced diagnostic beyond just a treadmill or any regular cardiology tests, followed by evaluation of your respiratory system, your ability to deliver oxygen to all parts of your body. And of course, there's multiple tests which your regular family practice doctor would offer, but we go beyond that. We incorporate not only more advanced testing, like sleep study at your house. You don't need to go to sleep lab anymore. We have connection to wonderful providers. One of them in Loma Linda University, followed by functional evaluation of function of your lungs, measuring little volumes and delivering information to you early, before asthma starts, before COPD settles, before autoimmune disease of the lung starts. And one of our very cool modalities in treating very early stages of disease when it's completely reversible, it's actually a way of exercise. And we practice here with our staff member, who also my nurse infuser, nurse injector in med spa. She's a Qigong master. So we have a class, we have a Qigong class which allow you to breathe deep, expand your lungs, bring the good energy in your body while you're moving gently but meaningfully, and developing new, what we call energy flow, blood flow, you call it, whatever you call it. But I see objective changes in the body in my patients, clients, my students who come to that exercise of Qigong, and we see the outcomes. And of course, in any functional medicine clinic, you would work with a doctor on your microbiome evaluation, seeing how much inflammation is in the gut, is there something missing, is there some kind of intruders which are not welcome by kind of hanging around. We have those tests through very advanced laboratories who we partner with. And of course, musculoskeletal system is very important in in the functional medicine. We're saying if you don't have a good frame, if you're fragile, if you don't have a muscle mass, if your bones are thinning and breaking, you don't have longevity in you, even with healthy brain. Our frame, our body kind of telling the story to the environment. If you're present, you're straight, have a good posture, you have strong muscles, people see it, and they recognize you as a vital and young. You can put all the Botox in the face, but you're all crunched down and not able to walk. You don't look young. Youth come from within. Youth come from every single part of your appearance. We strongly believe in that. And of course, I'm known for reversal of aging in us females in mid-lifetime, around the late 40s and early 50s. I treat a lot of menopausal patients with all different modalities. Bioidentical hormones is that what I know very well. Studied for many years and brought all my knowledge to you, so we can customize, compound bioidentical hormones. We use it in different forms, and so on and so forth. So there's probably 6 to 10 visits which I encourage my members to use while they're well. I don't sit in my office here and wait for disease to happen. Of course, urgent care is here. If you need me, you have my cell phone. If you need me, my team is here to catch you during the stress, during the important time when time is essence, to prevent your ER visit, hospitalization. We do it well. We have all my assistants, they are medical assistants, and we're hiring more. And I team up, or I include in my circle of care all the best specialists here locally in San Luis Obispo and the Central Coast area. And sometimes when we don't have a specialist for specific problem, I have a lot of experience working with Stanford and UCLA and Scripps and Mayo Clinic and Anderson's Cancer Centers in Arizona, and so on and so forth. Being in practice for a while is a big advantage of knowing little detail and nuances, how to direct patient care in time to prevent severe significant complications. That is very, very important. We do have a med spa here. As I mentioned, Botox is not going to fix your aging, but definitely refreshing image never hurts. So we all use it, of course, and it's fun to do, and there's always something new coming on something, new inventions, new products, beautiful skin lines, organic sunscreen. We keep an eye on this industry very closely. The Lapidus Clinic is member of so many different organizations which we support, and we also belong to gather more information and knowledge, and keeping everything modern and updated here in terms of delivery of our method, diagnostic treatment modalities. If you ask me, do you know peptides? I know peptides. We just received a phone call, somebody asked, oh, does doctor ever consider doing low-dose naltrexone? I practiced it for years, more than 10 years, low-dose naltrexone. Does she manage chronic diseases which other physicians shy away, like chronic fatigue? This is my bread and butter. And sometimes the last time my colleague called me saying, I'm referring this patient to you and I want to apologize. She's very, very nice patient, but you probably gonna just hate me because she has this chronic fatigue and this and that. I'm like, no, thank you. This is what we love to fix, reverse, and bring that patient back to life, to exercise, walking on the Bob Jones Trail, which is right here, one step away from the clinic, going to the pool, start swimming again, getting out of the house in the sun, walking her dog or his dog, enjoying life, meeting friends for late dinner, not just being bound to the house because everything is so difficult. And, psychological aspect of our health is very important topic here in this clinic. For years, I used to work with a psychotherapist who also was a neurotherapist. Now it's an independent contractor here next to us, but evaluation of psychological health, not only with questions, but also with a deep dive in the brain, biochemistry, genomics, and electrical activity. Is that what we like to do? This is so very important, and we have connections to very good psychotherapists, psychiatrists. It's in menopause, psychology, psychiatry is a big part of the deal. If you never experienced it, you don't know. Think, oh, I am strong, I'm type A. Depression, what is that? I don't even know what people are talking. Anxiety, me anxious about something, and all of a sudden, I cannot describe it, but this is that feeling inside of your chest that something is going on. Something gonna happen bad. That's how I defined for anxiety when I first experienced it myself. Me, strong, A-type, being a surgeon in the past, anxiety is not an option in my life, and yet I was like, wow, that can really disable me. I need to fix it. And we know how. I have the whole team here to catch you during that time. Hopefully we can meet you before it happens and prevent that. But yeah, this is absolutely my pleasure to deliver that type of medicine, to be here for you, to modify my clinic and my team approach to the problem with your ask. I was listening other day to Mercedes E-Class commercial, and that was their pitch. It's not only a car, we modify your experience to meet your needs. I mean, we be young, but that was the message, and it's kind of captured my attention. Like, yes, that's my goal. Not only deliver a very good care for you, but being able to be very plastic, very moldable around the patient need. With that in mind, we're starting to open clinic on weekends. So some Saturdays are coming, evenings are coming. We're expanding a team. We're having more medical assistants who can work part-time at night, who can work weekends. Because the next development of this clinic is to bring patients who not necessarily very well familiar with me, but want to have kind of bits and pieces of it. So we're starting to work with the retreats. We're starting to work with the medical retreats. It always was a fun creation in my mind, and it's materializing. We're completely full for our first retreat, which we're going to do here locally. But we're starting to plan the next one, maybe end of May. So for that one, if you're interested, please call my team and we'll put you on a wait list. And when we know the date, we'll let you know when it's happening. The other one in plans right now is south of Spain, Costa del Sol. We're trying to find a villa where we can bring our client, not just a hotel, but a villa where we can have a private chef, cooking classes, meditation together. So that's in action, that's happening. We had a great success with Mexico, and it's always an option. But once again, if group of people come to me, we like to take no more than 4 or 5 couples for the retreat. If you have a group of people who are interested in something like that, and you have specific thematic in medicine you want to weave into your meaningful vacation, let me know, and I'll design it for you and your friends. I'll design it for you and your friends. You even, when it's in process of creation, we even can choose our villa and location together. If you're interested in a particular area of Europe, South America, Asia, where you would like to go, I would bring in experts and we'll create itinerary which is absolutely fascinating and exciting, and you'll travel with your doctor. I found that during COVID, we started to kind of slow travel again, and our first group went to Mexico. That was very, very important to all of our clients, that the doctor is there with them. There's no language barrier. There's no need to go to any urgent care outside of the retreat, luxury retreat hotel area. If I need to do a room call, I am there, and also I'm there to support for information, little chats about nutrition, implementing it. So that's my new development. And of course, I want to spend a little time talking about program Ocean. So I mentioned a lot of different things. So obviously, if you want to be my concierge patient, it's easy. You just call the clinic, we walk you through the steps, my team will onboard you, welcome you. You will have access to electronic records. You can see everything which is happening in our back kitchen on your phone through your portal. You're able to communicate with us. So that's my big program, and it's very limited. And I believe with yesterday addition of 1 new patient, right now it's full. But you know, life is life. People are moving. They're changing. Situations sometimes change, and they need to come out of concierge care for a while. Most frequently, we carry them through a short period of rough times like floods and changes in insurance and financial situations. But you know, sometimes it's just not feasible to continue with that care, and we find our clients are very good providers where we transition them, and then it opens a spot for new clients. So check with us, be on the wait list. We always will find the way to help you either with me or similar providers. But what is open, and I am developing it very actively, is our Ocean program. Ocean program is bioidentical hormonal support and non-hormonal support of midlife transitional changes for men and women. I attract, of course, mostly as females in menopause, but when issues are gone, my gals ask me, hey, do you see men? My husband, he wouldn't admit to it, and he doesn't have hot flashes necessarily, but everything else I am going through, he's going through. I do have a lot of experience of helping men with all different type of hormonal therapy and non-hormonal management of weight gain, anxiety, fatigue, inability to build muscle like it was before. So both. That program is for both, and I encourage families, husband and wife, to join together so you can live meaningful life, being successful and enjoying it in your midlife and later, and being able to enjoy great sex. You know, this is what missing in most of the families and what breaking families, that frequent times when you go through menopause or hormonal changes, your partner is not a priority, and it's just hurtful, and it can be helped. Reach out, ask me for help. It's available, it's here. It's so important to be very attentive to what's happening to your body and mind in this time, because if you let it go too deep, sometimes reversal of it takes a little bit longer time. And of course, that program also for anybody who went through menopausal or andropausal change and now in 60s and 70s and trying to support vitality with all possible modalities, and there's many, and some of them of what you hear in social media, they're excellent and they work, and some of them is just total baloney. So please pay attention to what is scientifically proven. Don't just go with what's popular in social media or media, but come to somebody who has a very good background in academic medicine, layered with knowledge in functional medicine and expertise in the field. You know, one doctor cannot be expert of everything. One doctor can know a lot of all different modalities and how to bring team together, but one doctor cannot be expert in everything, because expertise requires reading, attending conferences, communicating with patients who have that problem. So very, very important. So I encourage you to call us. We have those video blogs we started with just introducing to our area a couple months ago, and it's on our YouTube channel where we're showcasing Avila Beach. But now every couple weeks I will be live with you and you can ask me questions. This video blog I would like to really keep it non-specific for any particular treatment. If you would like to go in more specific of any disease, what hormones I use, what diagnostic testing I'm gonna do, we have a different blog with a lot of extra as a benefits to you, access to our discount on products, also benefits of some discount in our med spa. So that will be in our library, accessible only to subscribers. If you don't want to be a patient yet, but want to kind of dive deeper in a knowledge of functional medicine and what we offer or hormonal therapies, reach out to us and we put you on a little monthly subscription for my library of those videos where we talk specifics of the treatment. The next one probably gonna be coming next week on Hashimoto thyroiditis and autoimmune disease, which is not a disease of thyroid. Thyroid is first target, but it affects your whole body. So we're gonna go in specific of diagnosis. We're gonna go into specific of treatment. We're gonna go into specific of supplements. Who are specialists to see? Will endocrinologists help you with those issues? Will functional medicine doctor help you with these issues? Is family medicine doctor enough? All of this we're going to discuss in very little details in that video presentation, and I will try to keep everything live so you can ask your questions. If for any reason, for example, I'm on retreat with my clients, I'm not available, we're going to record it, my team will take your questions and will answer all these questions one-on-one with you, so you will receive all the information. So with our Ocean program, if you become a member of Ocean program and you either visiting me here in California or you live in California or Florida, you can become my patient. You can be my patient during retreats. If you're here, I can treat you, even if you're from other different states. But my license is right now in state of California and the state of Florida. If you decide to become a member of our Ocean program, reach out, we'll send you more information. Right now it's locked at, I believe, $265 a month. We're gonna keep it at that price through the summer, and Then in September is our re-enrollment. September, October is our re-enrollment month. We'll have to reevaluate and see how much more team it requires as we're adding more members and we're adding more modalities and treatments and diagnostic tools, which can be part of that program. So we're going to reevaluate everything in September, but you can lock your yearly membership with us by monthly subscription right now, and through the summer it's going to stay the same. So I really encourage you to be very proactive about your health. Don't just passively listen, ask us questions. We hear, and there's no bad questions. You cannot know everything my marketing director knows. You cannot know everything I know. You're expert in your field. You're dedicated your life to your passion, and it's wonderful. Allow us to be a true experts in the medical home for you. Allow us to be your partners in health and augment your life with something absolutely valuable, your longevity, your functional longevity, which is not just living long years, but living those years with joy, with a smile when you wake up, with laughter of your friends around you, your family enjoying you because you can remember them. You're not demented in a nursing home in your 80s and 90s. Our life expectancy is increasing, and we need to endorse it. And with that increase, there's responsibility. We need to be very responsible. I turned 53 years ago. I'm 53 years old. So I was thinking, boy, first 50 years was just a crazy, crazy ride. From one country to another, to different residencies, changing my career and profession so many times, raising a wonderful child. So if my life expectancy is 100, I'm 3 years old. My eyes wide open. I'm all ears about what's happening in medicine. AI, bring it on. We're already incorporating it. If you control it and you train it, it's good for you. If you neglect it and let villains to train it, it's gonna be bad. AI is like a child, you know. If we go to OpenAI, to ChatGPT or other platform, and we put our positive, good thoughts, if we train it like we train our children, saying what needs to happen good in this world, then that AI gonna help us. It's not gonna kill us. And in our clinics, we use it for dictation, and it's much more clearer with my accent now. I have no problem. It dictates all the notes in a split seconds. We use it in some functional cardiology tests. Well, I didn't develop it, obviously. Some big institutions develop certain programs which help cardiologists to see heart arteries without need of putting catheters in your heart. AI coming on there. It's analyzing huge amount of data when we deal with genomics. It's helping us. It's our helper. So I'm 3 years old who is learning with 50 years of experience. How cool is that? My life is just starting, and I'm gonna mold my clinic to future need of my clientele and my lifestyle. And my future, I see my office outside, even though I really like my white desk. A lot of publications came out of here, and it's very comfortable, but I really want to challenge myself. I want to take this clinic outside of just brick and mortar setup. I want to go places. I love to travel. So why don't I see you during our travel time, and we resolve all the issues. We'll do the diagnostic before we depart. And instead of 1 hour visit with me, you will have a week, and we'll work on it. We eat healthy. We limit our alcohol. I'm not taking it away from you. We limit our alcohol. We drink only good organic coffee in the morning. And of course, you know, for those patients of mine who don't drink, don't start. It's a very good thing. It's a very good thing to stay away from alcohol, limit your caffeine. Nutrition, I forgot to mention, nutrition is that's how, let the food be your medicine. It works wonders. We took very interesting recipe from a health coaching program I went through during my COVID, and it's called Wild. And we come up with very specific blend of those vegetables which work for diabetes reversal like a charm. Cholesterol lowest I see in a bad cholesterol. Of course, you don't want to wipe your cholesterol out because that's a fat which regenerates your brain. So there's so many different things you can do with your life without taking medications. And as I mentioned, Qigong, it extends your telomeres. So it's truly regenerative exercise, which is super easy to do. Anybody, even person who is in wheelchair can do it. And with diet and exercise, I hate that expression, with the lifestyle modifications, with giving your brain your life and your consciousness higher purpose, you can achieve such a great results. Our body reflects on what our consciousness tell our body to do. We can heal our body. That's how every energy medicine belief, religions, and every deep dive in our conscious relation to our environment, our body, ourself, others, work. If you create positive thoughts, if you open your mind to something positive and you share it, wonderful things gonna happen to you. Wonderful things gonna happen to you. With that in mind, I hope you ask me some questions. I'm here to answer them. I let Bailey and Chad, my team, my support for the best customer care here team and marketing and do little things of everything type of team. Look at your questions right now and I'm here to answer them.
All right. Our first question is, how is your functional medicine practice different from other practices?
Well, I think by developing my own method of delivery that it differentiated from any other functional medicine practice. You know, we're definitely different from a routine family practice concierge like MD-VIP or other people because they're just there to waiting for you to show up with problems and then they fix it and they're like 1 a year physical. In our concierge program, we have, as I mentioned, we have 6 to 10 visits, depends on your need, of wellness and education and diagnostics. In the functional medicine, I deliver my Lapidus method where I go from system to system to system. So even if we're dealing with just one problem, cardiovascular problem, I still go through every single system and do diagnostic and evaluation and deep dive in your microbiome and your infectious presence in the body. Because as you know, if there is infection in your gums or if there is infection deep in your jaw, your heart disease not going to be fixed with just a simple medication. Or if you're dealing with hormonal issue and you're in menopause and diet kind of went off tracks for a while and because of that, or maybe antibiotic use or chronic stress, your microbiome is off, we can pile all the hormones on your body, but they're not going to work. All hormones, they depend on other nutrients in the body, on the B group vitamins, on so many different elements we absorb from the gut for activation of those hormones and healthy elimination. So we look at every single organ system, regardless if you're in my full concierge or in my ocean program, and that's how we're different from other practices.
Our second question is, what is your approach to treating menopause and perimenopause?
Well, this is, as I said, my bread and butter, and that's what we do very well. So When patients come here with questions about that particular time in their life, we look at this. First of all, we look at menopause as a disease because it's aging you. And with that mindset, we have totally completely different approach. As with any disease, my goal is reversing it. So menopause is a bunch of all different symptoms, one of which is osteopenia, bone loss. So we're reversing osteopenia, we're putting our patient in specific exercise program, we're letting them use specific equipment, which is evidence-based to show resolution. We're reaching for those peptides, we're reaching for specific hormones. Vitamin D, for example, is a hormone. We're reaching for specific nutrients. So that is full on just intervention. It's not just a little, okay, I am an expert in menopause, I'm going to stick a pallet in you and send you home. No, this is full body and mind approach. And as I mentioned before, psychological aspect of that program and therapy is very important for me in a big part of what we do here. And want to point it for you, when I was just starting to work in that area, you know, I did my medical stuff. I really did not spend much time on psychological aspect until my patient told me. I was constantly asking my clients, saying, what is missing? What do we need to do? And one very good advice was, you need a psychologist almost on call for us. And the other one, don't forget to mention it, you treat it, but don't forget to mention it to the clients, microbiome. So that's a big differentiator, and that's how we approach it, but eventually non-hormonal, like nutraceutical approach, bioidentical hormones, or if somebody cannot deal with any of it, then we have our ways of helping anyway with biofeedback, neurofeedback, and neurotherapy.
A follow-up question to that would be, are there ways to prevent or delay the symptoms of menopause for younger patients?
Absolutely. It's very important to address it very, very early in life. Changes starts when we're born. But of course, realistically, I think really thinking about it in late 30s, when those menstrual irregularities start to happen in girls, weight gain, mood swing in men, you know, really looking at your baseline, hormonal baseline, and knowing how your body deals with your own hormones or hormones given to you, very important, because it's going to shape everything for the rest of your life. And thank goodness for genomics, the study of gene interaction with inside of your body and with outside environment. Different from 23andMe, which is genetics. Different from ancestry, genetics, genomics. It's an active functional view on your genetic material, seeing how it's expressing and how it's interacting and how it's serving you or maybe not. Knowing that early on in your, as early as possible actually, I would say, as soon as you learn about it, do it. But really important in your 30s, so you're kind of mapping your whole plan of midlife hormonal changes early on. So if you support yourself nutritionally and with specific type of hormonal modifiers and hormonal support, like factors which stimulate growth hormone production and stimulate your own estrogen and testosterone production, very important. And unfortunately, there is not so many providers who call themselves menopausal experts who look at that way. So we look at the problem of hormonal change, which we used to accept for years as normal and inevitable. We look at it as some failure in our genome, maybe some mutation which leading to early hormonal changes and then to disease. That is very, very important. So I would say as early as you can, but definitely in your 30s.
Do we have time? Do we want to do one more question?
Yes, yes, absolutely.
Alrighty. Our final question is, do you have any experience treating chronic Lyme disease?
Yes, yes, that is very serious condition and neglected, same like menopause and andropause, neglected by general medicine with the statement, oh, since we don't have a treatment, we're not going to see you as a patient. Well, it's because they don't know about the treatments, and as yet we don't have a cure. You know, if you're unfortunate to have a chronic Lyme disease, if acute disease was missed, not treated, prophylaxed, or you have inflammatory pathway genomics, which can lead to that perpetual inflammatory storm and allow inflammation such as neuroinflammation, myalgia, fibromyalgia, arthritis. And there's modalities which can be supportive in terms of functionality of life. I suggest following certain trends in that, and the big one in the world right now is immunotherapy. We're starting to look at Lyme disease like it's a cancer. So there's a big development, and I'm about to go and educate myself. It will take me a trip to Europe and probably to Greece. But the practitioners already doing it in the Los Angeles area. So it's immunotherapy, SOT, immunotherapy, and hyperbaric chambers, very important, and the pulse therapy. But of course, it's going to be an episode on Lyme, when I'm going to go deep into protocols of what we do for Lyme disease, how we trigger spirochetes with hyperbaric therapy, how we blood them with antibiotic therapy, how we catch you on recovery on die-off reaction with detoxing and infrared saunas and so on and so forth, and IV vitamins. It's a very complex topic, but yes, I am not an expert in Lyme, but I have referral sites for that, and I do very well with maintaining my patients with all the modalities we have here in the clinic. It's a very serious issue. Very serious issue. It's much harder sometimes to treat than common cancers. But yeah, just a quick spin off cancers. I'm not an expert, but there is a lot of functional medicine approach to treating patients post chemo and radiation therapy. Quick example: hyperbaric oxygen therapy. My partners are here on the premises, not my business, but it's kind of now becoming my expertise. Hyperbaric oxygen therapy is insurance covered modality for specific post-radiation tissue damage after treating cancer with radiation. Breast, prostate, abdomen, peripherals, extremities with non-healing wounds, bleeding, pain, contractures. Check it out. They're right here, Abispo Hyperbarics. They're a big part of my treatment protocols. That's why they're here. I wanted them to be on the premises. That's why 7 years ago I asked them to join, and they're renting space here, and we just love having them next door. Absolutely love it. But to sum up, I think that was a wonderful time, and I love that we actually drew some attention and there was an interaction. In the future, we'll see the way so we can give microphone to you, and we have a real conversation here. I also planning to bring some experts in all different areas of what I don't know, maybe Lyme disease, and have an interview. I would like to do that for you. Meanwhile, we want you to reach out for more information. We're gonna put our phone number and our website and our email out there for you on the Lapidus Clinic Facebook, Instagram. We have the Lapidus Clinic YouTube channel, so we're gonna blast all this information So you have multiple ways of reaching out to me and my team for more information, for subscription, for more in-depth blog. And if you decide to become a member of this program, one way or another, to this program and our med spa retreats. Have a blessed day. Love you all, and I talk to you soon. Thank you.